Hello, my name is Han-Seok Jo, and my student number is 32194417. And today, I'm going to talk about the basics about gingival recession, diastema, frenectomy, and the cure for gingival recession and diastema. First, I will start with frenectomy. A frenectomy is the removal of a frenulum, a small fold of tissue that prevents an organ in the body from moving too far. It can refer to frenula in several places on the human body, and frenectomy is a very common dental procedure that is performed on infants, children, and adults. This picture shows the frenectomy that is used on the upper frenulum between the upper gum and the upper lip. Now we have known the basics about frenectomy, we have to know the types of frenectomy. There are many types of frenectomy, and today I'm going to talk about 3 types of frenectomy. The first type is lingual frenectomy. Lingual frenectomy is a treatment for a tongue tie. This picture shows the lingual frenectomy. The before picture shows the frenulum attached to the front of the tongue. If the frenulum is attached to the front of the tongue, we cannot speak well because our tongue will not move freely. So we have to get rid of it by using lingual frenectomy. The second type is labial frenectomy. Labial frenectomy is very common with patients undergoing dental treatment to get the proper fit of dentures or patients who have tissues attached to center of the upper lip and causing recession of gums or gap between the upper front teeth called central incisors. The last one is the one used between two teeth. Frenectomy can also be performed to remove a section of tissue that attached to the gingival tissue between two teeth. Now we have known the basics and types of frenectomy, we have to know about gingival recession. Gingival recession, also known as receding gums, is the exposure in the roots of the teeth caused by a loss of gums tissue and or retraction of the gingival margin from the crown of the teeth. Gum recession is a common problem in adults over the age of 40, but it may also occur starting from the age of a teenager or around the age of 10. Now we have known the basics of gingival recession, we have to know the causes of gingival recession, because when we know the causes, we can prevent it from happening. There are many causes of gingival recession. The most common cause is gum disease, also known as periodontal disease. Second is over-aggressive brushing. Third is improper flossing. If you floss too roughly or aggressively, the floss may cut into the gums and cause gingival recession. Also, self-inflicted trauma, such as habits like digging a fingernail or pencil into the gum, may cause gingival recession. And this type of recession will be more commonly associated with young kids. There are many other causes of gingival recession, such as dipping tobacco, which affects the mucous membrane lining in the mouth and cause receding gums over time. Now we have known the basics and causes of gingival recession, we have to know the symptoms of gingival recession. First, the basics about the symptoms. Gum recession is generally not an acute condition. In most cases, receding of gums is a progressive condition that occurs gradually over the years. This is one reason that it is common over the age of 40, because the changes in the condition of the gums from one day to another are minimal. Patients get used to the gums' appearance and tend not to notice the recession visually. Receding gums may remain unnoticed until the condition starts to cause symptoms. First, tooth mobility will appear. Second, dentin hypersensitivity will appear too. Short, sharp pain will be triggered by hot, cold, sweet, sour, or spicy food and drink. If the cementum covering the root is not protected anymore by the gums, it will be easily abraded, exposing the dentin tubules to external stimuli. And the teeth may also appear longer than normal, because a larger part of the crown will be visible if gums are receding. Also, the roots of the tooth will be exposed and visible, and the tooth will feel notched at the gum line. Also, if the gum recession is caused by gingivitis, puffy, red, or swollen gums, or gum bleeding while toothbrushing or flossing, or bad breath will happen too. Now we have known the symptoms of gingival recession. We have to know how to cure gingival recession. There are many kinds of cure to gingival recession, and today I'm going to talk about two kinds. First one is by frenectomy. In some cases of gingival recession, it happens because of the overextending frenulum. Because the frenulum is overexpanding, it grabs the lower, and cause gingival recession. So we can use frenectomy to remove that frenulum and get the gum to normal position. The second way to cure gingival recession is through gingival grafting. Depending on the shape of the gum recession and the levels of load around the teeth, areas of gum recession can be regenerated with new gum tissue using a variety of gum grafting called periodontal plastic surgery. These procedures are typically completed under local anesthesia with or without conscious sedation, and it may involve repositioning of adjacent gum tissue to cover the recession, or use of a free graft or gingival or connective tissue from the root of the mouth. Now we have known about frenectomy and gingival recession, we have to know about diastema. Diastema is a space or gap between two teeth, and diastema is primarily caused by imbalance in the relationship between the jaw and the size of teeth. And if the labial frenulum pulls, it can also push the teeth apart and cause a diastema between the center of the two front teeth. So we have known the basics about diastema, and now you have to know how to cure diastema. In some cases of diastema, it could be cured by frenectomy. Because some cases of diastema happens because of the labial frenulum, we can use frenectomy to remove the labial frenulum, and then we can cure diastema. Thank you for listening to my presentation about the basics about frenectomy, diastema, and gum recession, and the cure for gum recession and diastema. Thank you.